Are there declines in the physical health of breast cancer survivors who received chemotherapy? Well, that's a really important question. Let's take a look at the answer. Hi, everybody. I'm Dr. Jay Harness, the founder of Cancer Fitness, and I'm also the Chief Medical Officer at Maple Tree Cancer Alliance. So the question is, are there declines in the physical health in breast cancer survivors who receive chemotherapy or endocrine therapy? Here's an important publication from Open JAMA Network entitled Physical Health Declines After Chemotherapy or Endocrine Therapy in Breast Cancer Survivors. Breast cancer survivors experience a greater decline in physical health than women without cancer. Patients who received chemotherapy showed the most significant and long-lasting physical health decline. Women who received only endocrine therapy had some initial physical health decline, but returned to similar health levels as cancer-free women after 2 years. Beyond 2 years post-treatment, a significant decline was observed only, this is important, only those who had undergone chemotherapy. Increased fatigue, reduced ability to perform daily activities were major contributors to physical health deterioration. The conclusions of the study included the fact that breast cancer survivors who underwent chemotherapy experienced long-term decline in physical health, while those who received only endocrine therapy saw more transient effects. The report suggests the need for exercise programs to manage post-treatment physical health deterioration. And as many of you know, multiple prior reports have demonstrated that exercise oncology programs mitigate the side effects of both chemotherapy regimens and endocrine therapy, and that these exercise programs, and this is really important, increase mental and physical health if continued into long-term survivorship. Now, here's a slide that I've shared previously on over 11,000 patients and their physical and psychological impact when they exercise during active treatment. And you can see across the board here, whether it's quality of life, cardiovascular endurance, muscular endurance, flexibility, more positive feelings, and feelings of support across the board, patients really benefited. So that it's really important to continue those out into long-term survivorship. Remember, exercise oncology programs have two components. The first component is the cancer center programs, including pre-rehabilitation, during active treatment, and post-treatment. But out in the fitness industry, which is a really good place for long-term survivorship programs, there are group fitness programs like the YMCA Live Strongs or Dragon Boat racing clubs. And there's an increasing interest in fitness centers and health clubs nationally and internationally on launching men's and women's separate survivorship programs. So please join us at Cancer Fitness. We know really well that movement is all key to vitality. Come and read our blogs, and particularly the more detailed blog on the decline in physical health in breast cancer survivors who received chemotherapy or endocrine therapy. Many thanks for your attention, Dr. Jay Harness.